The heart is a powerful muscle, the engine that keeps us alive. But it's not just muscle, it's also powered by electricity. An EKG, or electrocardiogram, is like a window into your heart's electrical activity. Imagine this. Tiny electrical impulses tell your heart to beat, to pump blood throughout your body. An EKG captures these impulses as waves on a screen or printout. These waves, with their peaks and valleys, tell us a story. They tell us how fast your heart is beating, if the rhythm is steady or irregular, and even if parts of the heart are working too hard. Understanding these electrical signals is like understanding the language of your heart. And for nurses, this language is crucial. Nurses are the front line of healthcare, the vigilant guardians of their patients' well-being. And in the realm of cardiac care, the EKG is one of their most vital tools. Why is EKG so important for nurses? Because it provides a quick, non-invasive way to assess the heart's function. It can detect a heart attack in progress, identify dangerous heart rhythms, and even provide clues about underlying heart conditions. Think of the EKG as a nurse's sixth sense, giving them a glimpse into the heart's inner workings. This information empowers them to make informed decisions, provide timely interventions, and ultimately, save lives. Let's step into the bustling world of a busy hospital. A nurse is checking on Mr. Jones, a patient recovering from pneumonia. He's feeling a bit lightheaded, and his heart rate seems a bit fast. The nurse quickly attaches EKG electrodes to Mr. Jones's chest. Within seconds, the EKG machine springs to life, displaying his heart's rhythm on the monitor. The nurse, trained to interpret these electrical signals, notices something unusual, a slight irregularity in the rhythm. This early detection allows the medical team to intervene promptly, preventing a potential complication. This is just one example of how EKG empowers nurses to provide proactive, life-saving care. The story of the EKG is a testament to human ingenuity, curiosity, and the relentless pursuit of knowledge. It is a journey that bridges the gap between the invisible mysteries of the human body and the tangible world of science and medicine. The EKG, or electrocardiogram, is now a routine part of medical care, but its origins are rooted in a time when the heart's electrical activity was a complete enigma. It all began in the late 19th century with a Dutch physician named Willem Einthoven. Born in 1860, Einthoven was a man of vision and determination, driven by a deep fascination with the workings of the human heart. At a time when medical technology was still in its infancy, he dared to imagine what others thought impossible. Einthoven was captivated by the idea that the heart, beyond its rhythmic beating, generated tiny electrical signals. He wondered if these signals could be measured, recorded, and interpreted to reveal the secrets of heart health and disease. This curiosity set him on a path that would change medicine forever. At the time, the heart's electrical world was hidden, impossible to explore with the tools available. The concept of measuring such faint impulses seemed almost magical, and many believed it could never be done. Yet, Einthoven was undeterred by skepticism. Driven by his visionary spirit, Einthoven believed these electrical signals held the key to unlocking the mysteries of the heart. He spent countless hours in his laboratory, experimenting, failing, and trying again, always pushing the boundaries of what was thought possible. He dedicated years of his life to developing a device sensitive enough to capture these faint impulses. Through tireless effort and innovation, he invented the string galvanometer, a groundbreaking instrument that could finally record the heart's electrical activity with remarkable precision. The string galvanometer was a marvel of engineering for its time. It used a delicate filament of silver-coated quartz suspended between powerful magnets to detect the heart's electrical currents. This invention transformed invisible signals into visible tracings, allowing doctors to see the heart's rhythm for the first time in history. In 1924, Einthoven's groundbreaking work was recognized with the Nobel Prize in Physiology or Medicine. His invention not only revolutionized cardiology, but also paved the way for countless advances in medical science. Today, every EKG performed is a tribute to Einthoven's dream, his perseverance, and his belief that the secrets of the heart could be revealed through science. The emergency room is a whirlwind of activity, a place where every second counts, and the line between life and death can be razor thin. The air is thick with urgency, the sound of beeping monitors and hurried footsteps echoing through the halls. Here, medical teams are always on high alert, ready to respond to the unexpected at a moment's notice. Suddenly, the doors burst open. A young woman named Sarah is rushed in on a stretcher, her face contorted in pain. She's clutching her chest, struggling to breathe, and her voice trembles as she tries to explain her symptoms. The team quickly learns she's been experiencing severe chest pain for the past hour. Sarah is pale, beads of sweat dotting her forehead, and her breathing is shallow. Fear is written all over her face. She's not just in pain, she's terrified, unsure of what's happening to her body. Instantly, the ER team springs into action. Each member knows their role, moving with practiced precision. One nurse checks her vital signs, another prepares the crash cart, while a doctor quickly assesses her condition. Without hesitation, an EKG is ordered. Sticky leads are attached to Sarah's chest, and the machine is powered on, ready to reveal what's happening inside her heart. The monitor flickers to life, its screen illuminating the room with a series of jagged lines. The team watches intently as the first readings appear, searching for clues in the electrical activity of Sarah's heart. Suddenly, the pattern on the screen changes. It's ventricular tachycardia, a dangerous, life-threatening arrhythmia that can cause the heart to stop beating at any moment. The gravity of the situation is clear to everyone in the room. The EKG has sounded the alarm, its urgent warning impossible to ignore. The team knows they have only moments to act before Sarah's condition worsens. Guided by the information displayed on the screen, the team moves swiftly and decisively. Every action is coordinated, every second is precious. They prepare medications and ready the defibrillator, all eyes on Sarah and the monitor. Medications are administered through an IV, and the team closely monitors her response. Slowly, Sarah's heart rate begins to stabilize, her breathing eases, and color returns to her cheeks. In this critical moment, the EKG has truly been a lifesaver, providing the rapid diagnosis and guidance needed for the team to intervene and save Sarah's life. Thanks to their quick thinking and the technology at their fingertips, Sarah is given a second chance. The rhythmic beep of the EKG machine is a familiar sound in hospitals and clinics around the world. But for nurses, understanding EKG goes far beyond recognizing the beep. It's about deciphering the intricate language of the heart's electrical activity. Nurses are trained to recognize different EKG patterns, each representing a different heart rhythm or condition. They learn to identify normal sinus rhythm, atrial fibrillation, ventricular tachycardia, and a host of other cardiac events. This knowledge is power. It empowers them to communicate effectively with physicians, provide timely patient education, and advocate for the best possible care for their patients. In the ever-evolving world of healthcare, nurses are constantly seeking ways to enhance their skills and knowledge. The demands placed on nurses today are greater than ever before, with new technologies, treatments, and patient needs emerging all the time. To keep up, nurses must be proactive about their professional development, always looking for opportunities to learn and grow. One of the most valuable areas for growth is in mastering EKG interpretation, a skill that is becoming increasingly essential in modern healthcare settings. Mastering EKG is not just an option, it's a smart investment in their careers and their patients' well-being. Understanding EKGs allows nurses to play a more active role in patient care, from the emergency room to the intensive care unit. It means being able to recognize subtle changes in a patient's heart rhythm, respond quickly to emergencies, and communicate effectively with the rest of the healthcare team. This expertise is highly valued by employers and can set a nurse apart in a competitive job market. By developing a deep understanding of EKG, nurses can really make a difference. They become trusted resources for their colleagues, often being the first to spot critical changes in a patient's condition. This not only improves patient care, but also builds a sense of pride and accomplishment in their work. Hands-on EKG training gives nurses the confidence to act decisively, knowing they have the knowledge to back up their decisions. They can enhance patient safety, because early detection of cardiac issues can be the difference between life and death. When a nurse can quickly interpret an EKG and recognize warning signs, they can alert the medical team and initiate life-saving interventions without delay. This proactive approach not only saves lives, but also reduces complications and improves the overall quality of care that patients receive. They improve patient outcomes, since timely interventions lead to better treatment outcomes and faster recoveries. Patients benefit from nurses who are skilled in EKG interpretation, as they receive more accurate assessments and quicker responses to their needs. This can mean shorter hospital stays, fewer readmissions, and a smoother path to recovery for those facing heart-related health challenges. Nurses also boost career advancement, as specialized EKG knowledge opens doors to new opportunities and leadership roles. Hospitals and clinics are always looking for nurses who bring specialized skills to the table, and EKG expertise is in high demand. Whether it's moving into a critical care unit, taking on a teaching role, or stepping up as a team leader, EKG mastery can be the key to unlocking new career paths and professional recognition. And they increase their confidence and competence because mastery of EKG empowers nurses to provide the highest level of care. With every EKG they interpret, nurses reinforce their expertise and build trust with patients and colleagues alike. In the end, investing in EKG training isn't just about learning a new skill, it's about shaping a more rewarding, impactful, and successful nursing career. Technology is rapidly transforming the landscape of healthcare, and EKG is no exception. New innovations are making EKGs more accessible, portable, and easier to use than ever before. Wireless EKG monitors allow patients to be monitored remotely, providing continuous data to healthcare providers. Smartphone apps are empowering patients to take an active role in monitoring their own heart health. And artificial intelligence is being used to analyze EKG data, assisting healthcare professionals in making faster, more accurate diagnoses. As technology continues to evolve, nurses will be at the forefront of integrating these advancements into their practice, using EKG to deliver even more personalized and effective care. From Willem Einthoven's groundbreaking invention to the sophisticated EKG machines of today, the science of electrocardiography has come a long way. But one thing remains constant: EKG's profound impact on patient care and the nursing profession. EKG is a powerful tool, providing a window into the heart's electrical secrets. For nurses, it's more than just a machine, it's a lifeline, a sixth sense that allows them to provide compassionate, informed, and potentially life-saving care. As we look to the future of healthcare, one thing is certain: EKG will continue to play a vital role in shaping how we diagnose, treat, and care for our patients.